Approximately 12% of Americans suffer from migraines. A migraine is a pounding, throbbing headache that is unlike anything you could ever imagine. I personally have suffered from migraines, and after a personal interview with Mrs. Alenia Damis, a documented interview with Mayo Clinic neurologist Dr. Jerry Swanson, and an academic journal written by Dr. John Rothrick of the University of Alabama at Birmingham, I feel that I have a better idea of what it is that I'm suffering from. Migraines are a life-changing illness, and more people need to be educated on how severe they can truly be. A migraine is caused by a change in the brainstem and its interactions with the trigeminal nerve, a major pain pathway. Migraines can be triggered by a number of things, including hormonal changes such as menstruation and pregnancy in women, food additives, drinks with large amounts of alcohol and caffeine, stress, medications, change in sleep patterns, as well as a change of environment. After interviewing Mrs. Alenia Damis, I found that her triggers include barometric pressure, humidity, stress, and an irregular sleep pattern. The risk factors of migraines include family history, and Mrs. Damis explained to me that she has a family history of migraines on both sides of her family, as well as age, as most patients suffer a migraine, their first attack, by the age of 40, which Mrs. Damis has suffered from her migraines for around 40 years. Also, gender, as women are 3 times as likely to experience migraines, especially during pregnancy. There are 4 stages for a migraine. The first is the prodrome, which occurs 1 to 2 days before the attack and doesn't always necessarily occur. The symptoms for this include depression, food cravings, hyperactivity, irritability, neck stiffness, and uncontrollable yawning. The aura, which is usually the visual phenomena, doesn't always occur, but as Mrs. Adamus explained to me, she doesn't always have this, but when she does it, she sees glitters and such, and this can also have side effects of vision loss, pins and needle sensation, especially in the arms and legs, also speech and language problems. The next is the attack, which is the actual migraine, and it is usually made up of visual disturbances and builds gradually, and this part can last from 20 to 60 minutes. The final is the postdrome, which occurs after the migraine, and it usually makes the patients feel drained and washed out, and altogether the entire process could last from 4 to 72 hours. So Mrs. Adamus was explaining to me the medications that she takes for her migraines, and these medications include hydrocone, acetaminophen, Cambria, promethazine, Nucynta, as well as the occasional shot of ketorolac. And these medications do not stop the migraine. They simply just make it more bearable for her to go through the pain. And if they don't work, she usually ends up in the emergency room. And another treatment that chronic migraine sufferers have been using is Botox. The Botox treatments are usually 31 injections throughout the head and face, and you can be given the 31 injections a minimum of 5 times. And actually, when I talked to Mrs. Adamus, she explained to me that about 2 weeks ago, she actually received 42 Botox injections throughout her head and face, and they usually take about 10 to 14 days to set in, and I was lucky enough to talk to her after her 14 days went. And although she hasn't suffered any migraines, she said that the Botox has helped her chronic headaches. So, many people suffer from migraines, and there are so many others who have no idea what this suffering is like. It's important for people to be educated on migraines and the symptoms because someone that's very close to them could be affected by this horrible illness. The pain and suffering that the patients are forced to cope with is very controlling and is truly life-changing.